Welcome to this demonstration of your neurologic exam. We're going to use the checklist that was provided on Canvas for you, and myself and Dr. Morris are going to perform, or she's going to be my patient. I'm going to perform the checklist the way that we would like you to do, not only for your assessment, but also this is a good way to do a neurological assessment on your patients when you're out in clinic. So as we talked about in other classes, on your checklist on the second page, the general part of the checklist is going to require that when you come in to see your patients that you are dressed professionally with your jackets on. If you have a name tag, great, but definitely have on a jacket, either scrubs underneath or clinical attire. And then as you come in, make sure you introduce yourself, your name, and that you are a PA student. Also make sure that you confirm who is sitting in front of you. Ask the patient to confirm their name and date of birth, and then proceed to wash your hands before you do the exam, okay, which I will be doing here in just a moment. Also, make sure you explain the purpose. Tell the patient you are here to do a neurologic exam on them. And then make sure as you do the exam, you're giving clear instructions so that the patient knows if you need them to move or take off their shoes, that you give them clear instructions as you do that. Okay, so as we talked about last week for your mental status exam, that begins as soon as you walk in the door and you're talking to your patient and you're noticing if they are alert, if they are able to answer your questions in a way that makes sense. You're checking their emotional response to you. We call that the affect. And you're also assessing if they know who they are and where they are. So the first part of this, you're going to be assessing in your head, but if you don't verbalize it during an OSCE, we don't know that you're doing that. So what I'm going to do right now is I'm going to go ahead and start and wash my hands and then run into this assessment, the first section there, so I can demonstrate how to verbalize that, okay? So I'm gonna step over here at the door. We're gonna pretend that I'm outside, and I'm gonna knock. I'm gonna come in and say, hello, my name is Lisa Castleberry. I'm a PA student here with the Methodist program. I'm here to do a neurologic exam for you today. Would you mind confirming who you are with your name and date of birth?
Yeah, I'm Deborah Morris, and my date of birth is 7/2/1952.
Okay, and I would say that actually matches what I have for your chart. So I'm going to go ahead and wash my hands, and then we're going to move into your exam today.
Sounds good.
Okay. So I don't know that we always do a great job of mentioning this, but washing your hands means more than just quickly dabbing soap and rinsing. Make sure you're washing your hands long enough that you can sing happy birthday, okay? So that's roughly about 15 to 20 seconds, if I'm not mistaken. Does that sound right to you, Dr. Morris?
Yeah, and if you don't have a sink in the room, say, I just washed my hands in the hallway, and
That's
that
correct.
should be true.
Yeah, the assessment area in our H&P lab makes that difficult, so definitely verbalize that you've washed hands. Okay, so now you've washed your hands, and basically I've already assessed that this patient knows who they are. They told me their name, and I've assessed that they're alert and they're responding to me appropriately, but you would say something along the lines of, I am observing that you are alert, that you are at least oriented to who you are. You told me your name. Do you know where you are today?
Yes, I'm at the Methodist University Health Clinic.
Okay, and do you know what day of the week it is?
I believe it's Thursday.
Okay, so now you've just assessed their orientation to person, place, and time. And now I need to ask you some questions to help me assess your memory. Okay, so the first thing I want to ask, do you remember what you had for breakfast this morning?
Yes, I had a piece of whole wheat toast and a hard-boiled egg.
Sounds like a good breakfast. So that's testing short-term memory. And then I would also ask, can you tell me the name of the high school you attended?
Yes, it was Lewis Diriff in Allentown, Pennsylvania.
Awesome. That's assessing long-term memory. And then also, I didn't mention this earlier, but when I said out loud that you're alert and you're oriented, I would also say, I notice that you have a normal affect, which means you're responding to me appropriately in terms of your emotional state, okay? The next thing I need to do to assess your mental status is to ask a couple of questions to check your higher thinking function.
Okay.
So we're going to demonstrate 2 of these. This is under cerebration on your checklist, but the first one is the serial 7s. So I would say start at 100,
Okay.
and if you could subtract 7 and tell me what that number is.
93.
And can you keep subtracting 7 and tell me what that number is?
Sure. 86, 79, 72, 65.
Excellent. That's good right there. So that's one way. Another way to do it is ask the patient, would you spell world backwards, please?
Sure. DLROW.
That's correct. Okay, so that's a quick way to assess the mental status. And at this point, you would then move on to the physical exam portion of this, okay? So we're going to start off with, I'm going to put the checklist right here, the cranial nerves, okay? So with the cranial nerves, you want to try, if you can, just in terms of sequencing, to kind of go from higher up on the head to down near the shoulders, just to help you be more efficient. But whatever sequence that you can do, that you can remember, will be fine for not only the OSCEs, but also when you're clinically practicing. So I'm going to start with cranial nerve 1, the sense of smell, by just asking the patient, are you having any trouble with your sense of smell?
No, I haven't had a problem.
Okay, excellent. And then you would move on to cranial nerve number 2, which is going to assess the ability for them to see. Now, I left my Snell and eye chart elsewhere, but we're going to pretend that this is a Snell and eye chart that I have in my pocket, a pocket size 1. And to test their vision, what you can do is hold this in front of their nose and then flip it out and then up. And that's roughly the 14 inches from their eyes you need to assess their vision. And then I would say, would you cover your right eye for me, please? And with your left eye, read the smallest line that you can make out.
ZPLTOD.
Excellent. Now, if you'll switch eyes for me and do the same thing on the right.
ZPLTOD.
Okay. One note, if they need corrective lenses, make sure they have those on before you do the visual acuity test. Okay? All right. And then the next thing you're going to want to do is you're going to want to assess the pupillary reaction to light for this cranial nerve. And for this, I'm going to use one of the provided either ophthalmoscope or otoscope for the light. And if the patient's pupils are already a little bit dilated, it may help to turn off the lights to do this. But for demonstration, you would start off just asking the patient to look over your shoulder, and you would shine the light in one pupil and assess response. And then you would shine it again and assess the other pupil on the other side, the contralateral side, to see if it also responds, okay? So that's direct, and then doing this and looking on the other side, that's indirect, okay? And then same thing, you would move over here and assess this pupil, and then do it again and check the other pupil, okay? All right. So, and we have one more thing that we would normally do here. And actually, you know what? I just got that backwards. That was cranial nerve 3. That's fine, as long as you get everything
No, that's
done.
cranial nerve 2.
Yeah. So,
But it involves cranial nerve 3.
that's true. They're both involved.
They're both involved.
The other thing you want to do with cranial nerve 2 is a fundoscopic exam, but we haven't taught you guys that yet. That's coming later in the semester. So at this point, you would just verbalize. At this point, I would do a fundoscopic exam on the patient. Okay. Later in the semester, when you do your comprehensive exam, we will expect you to do that part. Okay. So for accommodation, what we're going to do is have the patient look over your shoulder at some point behind you. You could say up in the corner there. And then if you'll move your vision and focus on my finger. And what you're doing is you're testing the pupils and the eye's ability to accommodate what they were looking at to up close to where your finger is. Okay. So we also, when we're assessing the eyes and the ability to see, we want to assess the fields of vision. So the full retinal field. And if you think of a patient's retina and their vision, think of it like a big circle. And if you cut that circle into quadrants, you want to make sure the patient can see in all 4 of those quadrants in both eyes. Okay, so to do that, we're going to ask the patient to cover one of their eyes. Okay, and then using your fingers, you just want to hold up a certain number of fingers in each of those quadrants and have the patient tell you what they see. Okay, and you're using your own vision to do this. So just hold your hands up and go, how many?
4.
Okay, one more time. How many?
3.
Perfect. If you'll cover the other eye, we're going to do the same thing over here. All right, so how many?
2.
Okay, one more time.
4.
Perfect. Okay, now you assess their vision in a different way. So once you've done that, you're in perfect position to move into assessing cranial nerves 3, 4, and 6. And what you do is have the patient hold their head still, and then if you'll follow my finger with your eyes, and then you would draw your finger in an H pattern, okay? And then come back to center, go to the other side, and do another part of the H, and then back to center, okay? And what was I going to say? You're assessing the nerves, how they control the movement of the eye, and that allows you to see all 6 positions. That's what I was going to say. All right, so after you've done that, then you're going to want to move into checking cranial nerve 5. If you remember, cranial nerve 5 has a role in sensation of the face and some motor function, the muscles of mastication, okay? So for this part, I'm going to ask the patient, would you mind closing your eyes for me? I'm going to touch your face in different places. If it feels the same on both sides, please let me know, okay?
Okay.
So if you remember, the cranial nerve 5 has 3 branches.
Same.
And those are basically the areas that you want to assess for sensation differences, okay? Then you would have the patient clench their jaw, and you would feel the muscles, the temporal muscle, yep, up that high, thank you. And then you'd also check the masseter muscle down here, making sure that the muscle is engaged. That checks the motor function of cranial nerve 5. You've already done 6 with the eyes, so now we move to cranial nerve 7, and that's checking the muscle control of the facial expressions. So for that, you would want to say, would you mind raising your eyebrows for me and see the wrinkling of the forehead? Now if you'll close your eyes real tight, and I'm going to try to open them, don't let me. Good. Now if you'll puff your cheeks out for me. Good. And if you'll make a big smile so I can see your teeth. And go ahead and stick your tongue out for me and then wag it from side to side. Good. Now we went ahead and snuck cranial nerve 12 in there, but that way we're checking the motor function there, the face. And then what we want to do is check hearing. That's cranial nerve 8. And for this, you need to have the patient, or you can do it, cover one ear. So I'm gonna test your hearing by whispering. Okay, so I'm gonna cover this ear for you, and I want you to tell me what I say. Tomorrow. Good. Then you'll want to come over and do the same thing on the other side. Yesterday. Okay. Now I've said a little bit louder over here so you can hear me, but you need to whisper it behind their field of vision so that they don't see what you say. Okay. So that's 8. And so now 9, 10, and 12, we're back at the mouth again. So for this part, you're going to want to go grab a light source. And then you want to have the patient open their mouth wide. Okay, and then say ah for me, please. Ah. Great. And you're checking the movement of the soft palate and the uvula in the back of the throat. Okay. And then finally, we've got cranial nerve 11, which controls your ability to shrug. So you ask the patient to shrug against your hands, and then also to turn their head into your hand to check those neck muscles. Okay, great. So now that we've done the cranial nerves, we're going to move into the motor testing for the rest of the body. So we'll start with the shoulders. So if you'll have the patient hold their arms up, we call these chicken wings, but just hold your arms up. Don't let me push your arms down. Excellent. That's shoulder abduction we just tested. And then have the patient hold their arms up like this. We're going to check their elbow extension and then flexion by having them hold against resistance. Okay, and then we want them to hold their wrists out like this and have them push up against our hands to check extension, and then down to check flexion. Then we want them to grip our fingers and try to pull your fingers out. We're testing their grip. And then have them hold their fingers apart and try to push the fingers back together. Hold them tight, good. And then finally the thumbs, have them make a thumb like this. Hold your thumb, don't let me push it down. Great. So now we've just checked the motor of the upper extremity. Now I'm gonna get my stool, because I'm gonna sit down, but now we need to check the motor strength of the lower half of the body. So for the hips, to check flexion, I'm going to ask the patient to lift their leg against resistance. Good, on both sides. Great. And now to check abduction, I'm going to have the patient push out against my hands. Adduction, push in against my hands. Good. And you're assessing to make sure that it's even on both sides. And then for the knees, same thing. We want to have the patient pull their legs against your hand to check for flexion, and then kick out against your hand. Ooh, you're strong. To check for extension. Finally, do you mind if I slip off your shoes?
Oh, please, that's fine.
Okay, I'm going to check the motor strength of your feet. I'll just lay these down here for a second. It's the same thing. You'll have them push up against your hands to check for dorsiflexion and push down to assess for plantar flexion. Okay, excellent. We'll put that back on for right now. We'll come back and do some more things with your feet in just a minute. Okay, now if you wanted to wait and do the feet at the end, so they're only having to take their shoes off once, you can do that as well. You can wait and do that as part of your assessment of sensation and reflexes later if you'd like. I'm just trying to go in order so it makes sense, okay? So now we go back to our checklist. We've done our motor testing. Now we want to skip on down to sensation testing. If you guys remember in lab, we talked about different pathways in the spinal cord and different sensations, including things like pain versus light touch versus vibration. So one way to check light and touch and pain or sharpness is to use your Q-tip here. You can break the wooden part here to make a sharp edge, and you can use the Q-tip head to be a soft edge, and sometimes you can kind of pull the Q-tip apart to kind of give yourself like a little wisp, so it makes it easier to feel soft. And then what you tell the patient is, I need to check your sensation. So for this, I'm going to have you close your eyes for me, and we've already tested their facial sensation, so we're going to move on to their arms. You're going to feel me, actually if you open your eyes back for me one more second so you know what I'm doing. I'm going to take this Q-tip here in different areas of your body. I'm either going to poke you with this sharper end. It's not a needle though. I'm not hurting you, okay? I'm just going to gently poke you, or I'm going to gently kind of rub this cotton across. And I want you to verbalize, is it soft or is it sharp?
Okay.
Okay, so with your eyes closed, I'm going to go ahead and I'm going to, if she had on shorter sleeves, I'd go ahead and just kind of poke her up here around her shoulder area. What do you feel?
Sharp.
Sharp? Okay.
I can't tell. Sharp.
Okay.
Yeah.
All right.
And soft.
Okay.
Soft. Soft. Sharp. Soft. Sharp.
Okay, good. So she was able to differentiate those sensations in both extremities, and then I would do the same thing for her lower half. So again, I would start in the upper leg somewhere, and we'll just work around the clothes as we can. So with eyes closed, is this sharp or soft?
Sharp. Soft. Sharp. Sharp. Soft. 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 Sharp. Sharp. Soft. Soft.
Good. So she was able to differentiate again across her lower extremities. Okay. For vibration, where he is. He's actually in my pocket. Most of you had a chance to try this in lab, but this is the tuning fork that will emit a lower pitch, and so that works well for vibration. So for this, you're going to just gently hit it. You don't have to hit it hard because it'll keep vibrating forever. So you just want to hit it very gently against your palm. Don't touch this part with your hand, hold it at the base, and touch this part to the patient's most distal joint of her thumb. So, and explain what you're doing. I'm going to check your vibration sensation. Do you feel this vibrating?
Yes.
Okay, let me know when it stops. Okay.
Good stop.
And I can feel it as it's stopping. Since I'm holding it here and it's on her thumb, I can assess if she's telling me the truth or not. So yeah, you just don't want to hit it really hard because it'll keep on going. So the same thing. Forever, yeah. And in fact, if it just keeps going and going and going, yeah, we're just going to say that it stopped there just for demonstration. And then the same thing.
You can damp it if you need to.
True, you can slow it down. I'm going to do the same thing down here in the toe. So I'm going to do the same thing. If you'll tell me, do you feel vibration?
Yes.
Okay, if you'll tell me when it stops.
Okay, it's pretty much stopped.
Okay, all right, same thing on this side. Do you feel vibration here?
Yes.
Okay, let me know when it stops.
It's pretty much stopped.
Good, okay. So now you've checked sensation in 3 different ways, 2 different spinal tracts, okay? So now is the patient's ability to identify objects with their eyes closed. And we call this stereognosis. And I worked on that, saying that word correctly. So one way to do this is to have the patient explain to them, I'm going to be placing some objects in your hands, and I'm going to have you close your eyes and identify what you're holding.
Sure.
Okay? So you go ahead and close your eyes. We're going to start with your left hand. I'm going to place the object here. If you'll feel that and tell me what you're holding.
Feels like a key.
Okay, very good. All right. Now I'm going to place an object in your right hand. Tell me what you're holding.
Feels like a
A
pen.
pen. Excellent. Okay. The Lecranon process, you can feel the tendon there. So I just gently hold their arm and I strike that area. Okay, so it's subtle, but if you see and feel that area kind of jump back against your hand, that's a good sign. Now for the, am I saying it right? Brachioradialis. We want to have the arm, you want to position the arm so that the ulnar side of the hand is on the leg there, and then with the flat side of the reflex hammer, just gently strike in this region. And you might have to move a little bit closer towards the hand, but as long as you see a little movement there in the wrist or hand, that's a good sign. That's a positive response. And the same thing, you would want to do the same on the other arm. Okay, and then the same thing for the tricep, just above that little bony part of the elbow there. You strike the tendon, and then finally, okay, brachioradialis. And what you're looking for symmetry. Some people have really pronounced reflexes, almost hyperreflexive, but if it's on the same side, that may not be abnormal for them. Some people, you can barely get a reflex at all. The key there is symmetry. If they're similar on both sides, that's usually a good thing for the patient. If it's not symmetric, now we have other things to talk about. Okay, so for the patellar tendon, the patella, this bony kind of, we call it a kneecap out in layman's terms there. If you go just south of that, you'll feel the soft kind of indentation and then a hard bony prominence there of the tibia. So that soft spot, that's the tendon that you're trying to hit. So find that first, and then using the tip of your reflex hammer, gently strike that area. I typically put my hand right here because some people will kick you, or you can sit to the side, okay? So you would have them just sit still for you. And if this isn't going and they're watching like Dr. Morris is doing, one way that you can get their mind off of it and get a better response is have the patient close their eyes and pull their hands against each other like this. And that helps them relax. And then you can sometimes you can get a little bit better response. Or not. Okay, I'm gonna try the other side. If you don't get anything, stop. Don't keep hammering away because that's not comfortable. Okay, so she doesn't really have a response on either side, so that's a symmetric.
Yeah, I'm feeling it though, so
Yeah.
there's a little.
Okay. All right, so the next reflex you want to check is the Achilles. So again, the calf muscle back here, it terminates into this Achilles tendon that inserts on the back of the foot there. So you just want to gently kind of plantar flex the foot just slightly. And again, using the flat surface of your reflex hammer, you want to gently tap that area. Okay, and then you want to do the same thing on the other side. Sometimes a patient will try to lift their foot for you and just say, you know what, relax your foot, let me have it. And I kind of gently manipulate the foot so that they don't know what I'm getting ready to do, and then strike it. Now, if the reflex doesn't go, don't keep hitting it over and over. Give it a second to reset and try again, okay? That was a good one. I actually got one there. Okay, for the last reflex, we're gonna check the plantar reflex. And for this, you need a more sharp edge, not necessarily a blade, but something sharp like the tip of your reflex hammer. You're gonna take this and you're gonna start at the heel.
Yeah.
And you're going to basically, if you
Here, I can change positions
so we can see it,
easier
okay?
for you to see.
All right, if you can see there. So we're going to start basically, thank you, at the heel, and we're going to drag this reflex or this hard, sharp edge up the foot and around to just underneath the great toe. And what we're looking for is we want to make sure that her toes actually kind of come down. If they go up and they spread out, that's not a good sign. So that's what we're looking for. We're looking to just gently scrub across, make sure the toes don't splay and head northward. Okay, and then we do the same thing for the other foot. Okay, so we just do this and come up. And you put a little bit of pressure in it, but you know, don't be mean. But you do need to put in a little bit of effort into that reflex, okay? So we're done there, and always assist your patients if they need to sit up.
Especially when they're old.
Yep, so those are the reflexes. So let's just recap. We've done cranial nerves, we've done motor testing, we've done sensation, we've checked reflexes. So now we need to check cerebellar function. And for that, what we will have the patient do is first, using their hands, we're going to check some your ability to sense where you are in space and also keep your balance. I'm going to ask you to do a few maneuvers for me.
Okay.
So we'll start with your hands flat on your legs, and then if you will, as fast as you can, kind of move your hands back and forth like this.
Okay.
Okay, all right. And then the next thing we're going to do is I want you to put one finger on your nose, and then I want you to touch my finger with that finger. Okay, and go back to your nose, and then touch my finger again. Okay, good. Back to your nose, my finger. Good. And so that's checking their ability to maneuver in space. I don't usually do but one side. Do you do both?
Both sides.
You do. Okay, so we'll have them switch fingers. If you'll touch your nose with your other finger, and again, touch my finger, go back to your nose, touch my finger. Okay, good. Back to your nose, touch my finger. Good. Back to your nose. Excellent. And so the other thing we're going to do is we're going to test that with your lower extremity. So if you'll take that foot, the heel of your foot, and touch your knee and go down. Good. And do the other side, same thing, down from the knee down the shin. Good. All right. And so that concludes the portion with the patient sitting. Now I'm going to need you to stand up for me, okay? And for this portion of the exam, you're going to assess the patient. I'm going to stand right here as they walk. So I need you to please walk to the door, and you're checking her gait and posture. And now if you'll turn, and as you walk towards the chair, if you'll walk one foot directly in front of the other. Okay. This is the tandem walk. And be close in case your patient's a little wobbly. Okay. Okay, excellent. All right, now if you'll come to me right here, the last balance test we're going to do is the, you wouldn't tell the patient this, but on your checklist, this is the Romberg test. You're going to want to tell the patient, if you'll put your feet together for me. And you don't have to put their arms out for the Romberg, but I do because I go ahead and just check for pronator drift. That's not necessary, but I tell them, if you hold your arms out for me, and I'm going to stand right here. Don't touch them. I'm going to stand right here, make sure you don't fall, but I need to check your balance. If you'll close your eyes for me, I'm going to watch you for about 30 seconds. Okay? And you just want to make sure you're close by in case they start to wobble the wrong way. You can assist them back to the table or to a chair, okay? All right, great. So you're looking to make sure that they're not wobbling too far. Everybody wobbles a little bit, but you don't want to see people swaying and moving their feet. And you want to make sure that their arms stay out in front of them. For some pronator drift testing, if you, they may drop their arm, but if you kind of push on their arm should come right back up. And so that's a good sign. So thank you very much. And I think that concludes our exam today.
Nice.
So I would tell the patient thank you for coming in. Do you have any questions for me at this time?
No, that's the most thorough exam I've ever had.
That's what we like to hear. I'm gonna go talk to my preceptor and we'll be back. And then you
Okay.
can just excuse yourself from the exam room, and that completes your neurologic exam.
Good. All right.